Symptoms of diabetes and diabetes treatment in children. Symptoms of type 1 and type 2 diabetes are also generally difficult to distinguish and often resemble one another. Some children with type 1 or type 2 diabetes do not show any symptoms or feel any complaints. However, in some other children, diabetes can cause the following symptoms. 1. Frequent thirst and urination. Excess blood sugar levels will be excreted through the urine. This will make the child urinate frequently or even wet the bed. With a lot of body fluids that come out, the child will quickly feel thirsty and drink more than usual. 2. Appetite increases. Children with diabetes will have difficulty producing energy due to impaired function or reduced amounts of insulin. As a result, the child will often feel hungry and eat more for energy. 3. Weight loss. Although eating more than usual, but the weight of children who suffer from diabetes will actually go down. Without a supply of energy from sugar, muscle tissue and fat stores will shrink. Weight loss for no apparent reason is often the first sign of diabetes in children. 4. Look tired or lethargic. Children with diabetes may look weaker and lethargic due to a lack of energy in the body. Children can still look lethargic even though they have eaten in large quantities or portions. 5. Blurred vision. High blood sugar levels due to diabetes over time can cause the eye nerves to swell. This condition can make the child experience impaired vision or his vision feels blurry. 6. There are wounds or infections in the body that are difficult to heal. Due to high blood sugar levels, a child with diabetes will have sores that are difficult to heal when injured or injured. In addition to inhibiting the wound healing process, diabetes can also make children susceptible to infection. 7. Black skin color. Insulin resistance can cause darkening of the skin, especially in the armpits and neck area. This condition is called acanthosis nigricans. In addition to the above symptoms, a child with diabetes also often shows other signs, such as being fussy or crying constantly, breath smelling like fruit, and diaper rash. Diabetes treatment in children. Treatment of diabetes in children needs to be adjusted to the type of diabetes suffered by the child. To determine the diagnosis, the doctor will perform a physical examination and support in the form of blood sugar tests and diabetes autoantibody tests to determine whether the child has type 1 or 2 diabetes. If the child is diagnosed with type 1 diabetes, the doctor will provide insulin therapy to control blood sugar. Meanwhile, if the child has type 2 diabetes, the doctor will give anti-diabetic drugs. Insulin therapy can also be given to type 2 diabetes, if the diabetes suffered by the child is already severe. In addition, doctors will usually recommend parents to maintain their children's diet and invite their children to exercise regularly. Diabetes that is treated late will generally cause a number of severe complications that can endanger the condition of the little one. Therefore, make sure you check your child's condition to the pediatrician if he is a high risk or has shown some symptoms of diabetes in children.